Hello, everyone. My research topic is HIV pre-exposure prophylaxis uptake, related to knowledge, shame, and stigma within the Houston men who have sex with men community. Research statement: around 1.2 million individuals are living with HIV. However, most of them are gay, bisexual, and other men who have sex with men (MSN). Houston, Texas has also experienced with a lot of people who are diagnosed with HIV, which is around uh, 28,000 people. It's important for us to focus on HIV reductions by helping the individuals with HIV with the treatment and care that free from stigma and discrimination so that we can promote condom use, increase awareness of the daily pill pre-exposure uh, prophylaxis. My focus is to explain the stigma and shame, knowledge, and sexual behaviors that surrounding PrEP uptake, since there have so many of the research around HIV stigma. However, there hasn't been a lot of PrEP uptake stigma and conspiracy belief around on the peer study, peer review study research. My list of reviews has different six different category and research focused. The first is the introduction to PrEP. PrEP is approved by the Food and Drug Administration for those who are high risk of acquiring HIV since 2012. People who are using it might receive the destructive attitudes and behaviors and perceptions towards them because they are being misjudged as a way to promote irresponsible sexual act or being promiscuous. Condomless anal intercourse. So the PrEP users uh, also receive the perception and stigma such as slutty or party drugs, with implications that they frequently engage in reckless sexual behaviors. Disparity in use of PrEP among minorities. HIV negative American, Black, Latino, MSM are among those who using PrEP at least the list. It's important to understand the racial disparities within the context of social stigma and psychological barriers that reduces PrEP uptake for HIV prevention from among Black and Latino MSM. Homophobia surrounding PrEP uptake. African American MSM might become down low who are engaged in homosexual behaviors, and gay bisexual teens are more likely to suffer from abuse, stigmatization, discrimination. So we can have a successful HIV prevention and PrEP, promoting PrEP awareness without knowing that homophobia is does exist around PrEP uptake. PrEP knowledge, stigma, and shame. So, like as discussed before, these PrEP user might have received perceptions as promiscuous, irresponsible, or especially the term that social media has been using, just as Truvada whore, especially among the MSM themselves. My theoretical framework, I use the Earnshaw and Caldor model of HIV with different construct measures such as the mechanism leading to the outcomes from HIV uninfected individual as well as HIV infected individuals. So I use this um, uh, construct and measures to explain similarly to the fact of I want to explain on the PrEP stigma, shame, and knowledge using these construct. I also applied the health belief model to explain the survey participants' perceptions of PrEP stereotype associated with stigma, shame, and knowledge. Research question. Uh, the research questions is the relationship exists between items such as age, educations, and number of sexual partner, and level of PrEP use related to shame stigma. The research question number two is whether PrEP and stigma, PrEP's shame and stigma related to number of sexual partners and HIV history. The third one is PrEP related use and stigma have a higher predictive value in determining HIV testing within the past 12 months. I have different five hypotheses. The methodologies is I used the mixed method purposive sampling 383 eligible participants in Houston Agri Crew from the LGBT venue universe, such as gay bars, Houston LGBT centers. I would provide incentive as a pre-HIV testing voucher, and my research is funded by the AIDS Foundation's Houston, and I will provide an open-end and closed-end survey through standardized questionnaires using Quadric, which is the electronic tablet and embedded. Um, it will be submitted for approval by California State University of Norwich IRB. Inclusions criteria including the people who are over 18 years old and self-identification as male because I want to focus on the MSM itself. Methodologies, the phase one is survey validation, establish the phase validity. I want my service items go through the review by an infectious disease expert to determine their success in capturing appropriate information. Then I will conduct a pilot test to demonstrate the strength and weakness of the survey items by using approximate around 8 to 10 people who are taking the survey and discuss the survey items with researchers while notes are notes are recorded. This is the snapshot of my open-end questions for both open-end and closed-end. After that, I will um, uh, me along with the other approved investigators from CSUN's gonna conduct the data collections. I'm using SPSS software, uh, using the univariate analysis, such as creating means, medians, and standard deviation, and the table was used to represent the nominal and ordinal variables by variates. So the associations between each independent variable with dependent variable, such as PrEP uptake, stigma, and shame, is going to be accessed using the chi-square test. Um, the multivariate analysis. This will be analyzed based on the statistically significant result from bivariate analysis between independent variables and dependent variables. Results are described at odd ratio will be adjusted or unadjusted logistics regressions model, and a 95% confident interval will be generated.